I look at it at the broader perspective of any biological. We need to be prepared for any biological that may affect us, and we do a lot of the same pieces for each type of biological, Ebola being one of those. The chances of Ebola spreading within the community, outside the healthcare community, based on the information I've received, I feel is very small, but not zero. So we do need to be prepared, but just the same as we would for any other biological. We coordinate state resources to share with the local response community. And then we also work with our private sector partners, other states through the Emergency Management Assistance Compact, and the federal government through the Federal Emergency Management Agency. And our role is to get those resources that the locals need to address any incident they're working on. We have worked diligently, especially over the last 5 to 6 years, on continuity of operations, which is the key component to any pandemic. How are you going to continue to operate if a large portion of your staff is out, either due to the illness or helping with family members? And so we have come a long way in continuity planning, and we've worked with other state agencies to make sure they're prepared as well. A lot of telework, although we don't traditionally do that, we've been testing to make sure we're capable of doing that and continue to improve that plan. Review what your plan says you're going to do, your procedures. Be sure to address anything that may be a hazard to you. You want to protect your personnel and your equipment, and then get your protocols in place. So practice them so you know when something happens, you don't have to worry if you're doing it right. Build those relationships between the hospitals and the locals, the medical providers, anyone that might have access to someone that's presenting. Be sure and work those into your plan, and then test it and practice so you know you're ready.